Dr. Kevin Kavanagh. He is a retired physician and he founded an organization that has grown leaps and bounds called Health Watch USA, featured in all kinds of newspapers across the country. Good morning, Dr. K.
Good morning, Jack. I'm doing pretty well, staying safe and reading the news about the new variants, which is a little scary. So get boosted with the new booster, but overall, doing very well.
The new variants they're calling Scrabble variants. Have you heard that?
Yes, and I think you can tell that when I give my talk this morning, because there are so many numbers and letters, it's hard to keep them straight. It's like either playing Scrabble or a word twister. I mean, it's tough to keep track of them because we're being hit by a swarm, not just one, by about 4 or 5 different immune evasive variants, and it makes it very difficult to keep track of.
And they're calling them Scrabble because they are with the letters that are high numbered letters in the game of Scrabble, like B and Q. So tell us what's happening.
Well, right now, Kentucky is still decreasing in cases, which is good, but unfortunately, cases are hard to be tracking now. There's real reporting issues with home testing and just some of the laboratory testing. And so hospitalizations are best to look at, and Kentucky's hospitalizations are still continuing to fall. What is concerning over the last 2 weeks, and we'll have to check also to see what today's value is that the test positivity rate has been going up. And if you look at the Walgreens test positivity rate for Kentucky, it's plateaued at a high level of about 28%. Now, Walgreens runs much higher than our normal state reported test positivity rate, which right now is about 7.4% and increased to 8.5%. So it's still concerning, but hopefully we'll have a few more weeks before the winter surge, which I do believe is coming. When you look at what happened in Europe, you look at the immune escape potential of these variants, it's extremely concerning. And so if you want to try to give yourself the best armor, and certainly to help you avoid severe disease, getting the new bivalent booster is something you should strongly consider doing.
And this is for what age range?
Well, any age range that can get it. I think you'll be looking at younger kids all the way up to adults. I believe the CDC has lowered its age of availability of the boosters down to children in the younger age group and bracket, and I would certainly talk to your pediatrician or advisor about that. Now, one of the big things is that they are not requiring boosters for young children, and certainly that is something that needs to get out there, is that there is no requirement. And that's not on the table. That's a political talking point. These are just vaccines and boosters, which at this point are authorized. They're not approved. And I think that it's important that kids at a very young age get them. That's what I've recommended for our grandchildren. Our grandchildren have got them. CDC has moved to place these on the regular childhood vaccination schedule. And it will give your children a layer of protection. Remember, kids are still concerned about long COVID. And also, hopefully, it will help to decrease transmission because children do spread this to their caregivers and to others. So, children, it's important, but also the elderly, it's very important. Right now, greater than 65 years of age, those that have gotten the new booster, only 10%. That is way too low. With these new immune escape variants, it is unlikely that the old booster or the vaccine will give you the adequate protection that you're going to want. You're going to want to get this new booster. And that is the same for natural infections. If you've had a natural infection that is prior to the BA.5 variant, you're probably not going to have good protection, at least not the protection you're going to want. And of course, if you've had the BA.5 variant and you've had a natural infection, many people are advising that you not get the booster for at least 2 to 4 months because you want to let that immunity wane some before you reboost it. Otherwise, you may not get the full effect. So all of this, I think, is something that people need to really take heed of. I mean, Jack, the pandemic's not over. One of the big news items was the CDC Director became positive for symptomatic COVID. Now, they said it's a mild disease, but for CDC definition of mild disease, that tends to be out of the hospital. So you still run risks whenever you get this. I'm sure she went on either a monoclonal antibody product or a Paxlovid. And it's something that, if she can get it, anybody can get it. In fact, I've had two friends that have come down with COVID-19 symptomatic after the bivalent booster, but all of them had a truly mild disease in that they were at home, symptoms just a few days, didn't get long COVID, didn't get in the hospital. Paxlovid is probably your best choice if you can take it, because some of these variants, such as the BQ.1 and BQ.1.1, totally evade the monoclonal antibodies. Vaccines are better because they give you more of a breadth of antibodies, and they would be expected to mitigate the symptoms and the disease that you would get. So boosters are good. You're going to get more protection. Monoclonal antibodies with these new variants are not going to be as effective. Paxlovid, if you can take it, is still very effective. If you can't take Paxlovid, the other choice is Molnupiravir. I've had one friend that had to take that because they couldn't take the Paxlovid because of drug interactions.
All right. Well, we're out of time, but as always, we appreciate you very much. Thank you, Dr. Kevin Kavanagh.
All right. Thank you, Jack.